these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office, experts on what they're talking about.
This is the podcast
for insights into the issues.
China, bioterrorism, Medicare for all, in-depth discussions.
Breaking it down into simple terms. We hold
these truths.
With Dan Crenshaw.
The Eagle has landed.
Welcome back, folks. Great episode today. I want to talk about obesity. It's a clear and present threat to the United States. Let's be honest. But compared to other issues, I think it gets comparatively less discussion in Congress, even at the state level. Now, on the one hand, it might be unreasonable to micromanage people's personal nutritional decisions. On the other hand, we clearly have a problem that we can't ignore. More than 1 in 3 young adults are too heavy to serve in the U.S. military. 25% of young adults and 50% of Americans have pre-diabetes or full-fledged type 2 diabetes. Diets are so bad that people have mostly given up being alarmed about it. And despite its harm to individuals, it's been normalized and even encouraged. The public decided that hurt feelings take precedence over public health, even if it means millions of early deaths and devastating health consequences like leg amputations. So what do we do about it? Today, we're joined by an expert on the benefits of food as medicine. We're here with Calley Means. Now, he's the founder of True Med, a company that issues prescriptions for food and exercise. I didn't know you needed a prescription for that. I'm going to ask you about that. You enable tax-free spending on items promoting health. We'll talk about that kind of idea I'm more familiar with. Graduate of Stanford, Harvard Business School, been in the Bush White House, been at the Heritage Foundation. Look, you care about obesity. All right. So, hey, Calley, thanks for being on.
Thank you. It's great to be here and discuss this important topic.
So I guess we should kind of frame the problem, talk about how bad the problem is, and then maybe we get to like what solutions might make sense. Let's go for the stat here. So according to the U.S. Department of Agriculture, the number of calories consumed per American increased by nearly 24% between 1961 and 2013. How did we get to this point? You know, and I've seen this kind of video. People post videos every once in a while online of like the 60s in New York.
Right.
And everybody's skinny, or normal. I don't know. Like, what happened? It's not something we think about enough, perhaps. I mean, what do we do as a nation to change this?
Yeah, let me kind of set up the issue as I see it, Dan, because it's taken me a long time. As you said, started my career in the swamp, grew up in Georgetown in Washington, D.C., and come to this from, having, after campaigns, worked for food and pharmaceutical companies, which are very related, which we can get into. But let's kind of set the problem, why I think this devil's bargain between food and pharma, really our health, and obesity is a big part of it, is the biggest problem in the world. 8 of the 10 largest killers of Americans are directly tied to food. 85% of healthcare costs are tied to conditions that are preventable and largely reversible by food. My mom, who's inspired me a lot on this, it was relatively healthy, but had prediabetes, like 50% of Americans, prediabetes or diabetes. And she was a normal patient, right? She was on metformin for diabetes. She had a statin for her cholesterol. She had, a high blood pressure medication. These were all normal rites of passages for Americans. And she dealt with obesity. And then she abruptly got pancreatic cancer. Cancer rates are going up. Dementia rates are going up. All these life-threatening conditions are going up. And the doctors, this was in 2021 at Stanford Hospital, said, "Oh, that's unlucky. She got pancreatic cancer." You actually trace many forms of cancer, including pancreatic cancer, Alzheimer's. These are highly related to what we're eating. Obesity is actually an early warning sign. Obesity is the visual result of cellular dysfunction. So if you actually look high level, top down, what's happening to American people, if you're actually like just thinking about public policy, and I have a new son as well, and it's our first son, and looking to the world he's going into. Look at a child's brain. Look at the human capital of this country. Right now, 50%, close to it, of teens are obese or overweight. 25% of kids have prediabetes. 40 years ago, if you asked a diabetes doctor in their entire careers whether it's that kid, they said none. Now it's 25% of kids have prediabetes or diabetes. 15% of children have fatty liver disease. This was a condition only seen among elderly alcoholics. Yeah. And the problem is, and what I would push on, is that we see obesity in this silo. Obesity is one leg of a many-legged stool, one branch of the tree of what I believe is the biggest issue in the country, which is we're being brought to our knees, both from a human capital and a budgetary standpoint. Healthcare is the largest and fastest growing industry in the United States, and most of that's tied to preventable food-based conditions. So I think we need to assess the problem and what the root cause is. And I think where we've lost our way is seeing obesity, heart disease, diabetes, all these metabolic issues as separate things, treatable and profitable in separate ways.
Yeah, on the one hand, it's very simple. On the other hand, it's multifactorial. And I want to highlight something you did bring up, which is the cost of the healthcare system. We're all complaining about, why are our healthcare costs so much higher than other countries and all this and all that. Well, our obesity rates might be a really good place to start. The number one cause. Do you have some? Do you have a little? Can you flesh that out a little bit more? The direct relation between our healthcare costs as a country and how much we pay for everything, why our insurance rates go up, and the obesity epidemic.
Yeah. So 80% of the United States right now, 80% of US adults are overweight or obese. Now this is not complicated. You kind of get to the reasons. This is very simple. It's because of our food.
You're eating like crap and you're not exercising. This isn't hard. That's why I said on the one hand, it's very simple. On the other hand, there's multifactorial in the sense that, you're describing the change in our, in the food industry and the drug industry. We'll get into that. But on the other hand, it's like, hey, human being, eat right and exercise. Like
I want to push on. I want to push on this because this is something I've really evolved on. Personal responsibility, of course, is essential. We have to have a bottoms up revolution of personal responsibility. But when you look around the American people, and where 50% of adults have prediabetes or diabetes, or 80% of adults are overweight or obese, Americans, since those pictures in the 1960s, haven't become systematically lazier. Americans haven't had a systematic death wish. And let's be clear, when you have severe obesity, you die 10 years younger than when you don't, because it's the obesity, but actually it's because the obesity is your cells malfunctioning. Yeah. It's too much glucose getting in your cells, and it's kicking out that glucose and it's turning into fat. It literally is the visible result of cellular dysfunction, which is diabetes and all the other diseases. So you're inevitably, you're just going to kill you is if you have obesity, your cells are malfunctioning, you're going to have prediabetes, diabetes, heart disease, cancer, all these things that are almost normalized in America. So I want to just push on this. And this is a very important point. As you said, I worked at the Bush White House, the Heritage Foundation. I'm a very ideological conservative. But I think you can't have a free market when it's a rigged market. And this takes me back to when I saw working for food companies. Food companies spend 11 times more on nutritional research than the NIH. They spend billions and billions of dollars on nutritional research. Back 10 years ago in DC, I helped funnel a ton of money from processed food companies, from the American Beverage Association, to research institutions from Harvard, Tufts on down, creating studies that are then shopped around Congress saying that sugar doesn't cause obesity. Just crazy studies. To this day, right now, the lead study from the NIH, the lead nutrition study, the Food Compass, says that Lucky Charms are healthier than grass-fed beef.
Wait, was that NIH or was that Tufts? I thought that was Tufts.
The NIH funded Tufts.
Okay, they got a grant from the NIH.
It had the NIH emblem on the study. Okay. Tufts. The NIH, 90% of the NIH money it's a grant making organization.
Yeah. They're not doing the research. I just want to distinguish that. Like
it's a Tufts.
I'm not trying. Yeah. I'm like, and I have no reason to attack Tufts. I went to Tufts. That's like my alma mater. So I'm like, damn it. Why'd you guys say this? It's so stupid. It's so stupid. I tweeted about it. I posted the same thing you guys posted on one of them.
Yeah. And we've been calling attention to that. And Joe Rogan kind of retweeted what we put out, and it caused an uproar. We actually spoke to the head of Tufts Nutrition School. And the fact of the matter, he's a dedicated person, but he has been paid personal payments. So not only is Tufts Nutrition School, they're propped up, and their lifeblood is donations from food companies, creating studies saying, back in the day, sugar didn't cause obesity. Now, Honey Nut Cheerios are better than than pasture raised eggs. He has received. I want to know their reasoning. Like I am begging to know the scientific reasoning of how serial. I am not a nutritionist. I'm just a normal guy that kind of knows what healthy stuff is and exercises, and like I don't need to be. I don't think you need to be an expert. This is also why I'm like I'm maybe a little bit more. I place the blame on the individual a little bit more than you do, because I'm like, I don't understand how in the age of the internet you don't know these things. I don't understand it. Like there's no way that you can't know. Anyway, but what was their I don't want to keep jumping around. What was their explanation? What was his explanation? Like, how was he trying to defend Lucky Charms better than steak?
It's just not true.
So I'll just
right?
report what he said. So he called me, Dariush, the former dean of the school, did the study. He's still very involved with the school. Saw, the uproar for Joe Rogan talking about it. We went on Tucker Carlson. It's an interesting example of what's happening at scale. There's been 50,000 nutrition studies created in just the past 2 years. And I told you, I saw this. The goal is to create confusion. So I asked him point blank why Cheerios was rated higher than quinoa and whole grains when the study was funded by processed food companies in addition to the NIH. And he went on a 10 to 15 minute explanation of how I didn't know what I was talking about, and processed highly manufactured grains like Lucky Charms are actually healthy with these frankenfoods. And he cited my credentials or lack of them in nutrition and said that it is an open question whether the grains in Lucky Charms are as good as whole grains like quinoa, and defended that study. I asked him point blank whether the fact that he has received many personal payments, not research, personal payments from food companies, and interestingly, personal payments. The head of this study is receiving personal payments from the leading direct-to-consumer prescriber of Ozempic, the obesity drug.
Yeah. We'll get into that.
I asked him whether that impacts, and the fact that the study itself is impacted. It's just a question we all would want to ask. Does this impact the fact that it's funded by Danone, which is the largest maker of almond milk, and the fact that under dairy, chocolate almond milk was rated higher than grass-fed Greek yogurt as a dairy? Did that have any impact? He said no. I do love chocolate almond milk. It's great, but this is the highest rated dairy. And we had dozens of name brand cereals written as encouraged. He said that the funding had no impact. And it's very important. This is actually what the nutrition and what food companies do. He said, we can't expect a lower income person to go from Honey Nut Cheerios to eating broccoli. They need to go from Honey Nut Cheerios to Cheerios. And it's all this complication. And my point there, Dan, is that humans are the only animal that's systematically obese. Yeah. Humans and animals we've domesticated like dogs that we feed.
Yeah.
There's no obese wolves in the wild. There's no depressed or cancer. Like the rate of cancer among wolves in the wild is like 1%. The rate of cancer among dogs that we've domesticated is 60%. The rate of depression among dogs is over 50%. Okay. The obesity rate among dogs is over 50%. It's the same with humans. The only difference that we have as animals versus every other one in the wild is that we're being told by experts with 50,000 nutrition studies in the last 2 years, which are directly made to complicate nutrition policy. We get into this intellectualizing where literally he's debating and talking about peer-reviewed research, whether Lucky Charms grains are better than natural grains that have been around for hundreds of thousands of years. We're being gaslighted. The biggest lie that's happening in nutrition right now is that it's complicated, right?
Yeah, I agree.
The core of our, yeah. So
I didn't mean to interrupt you. I totally agree.
No.
I mean, it's like, I tell people like, what should I do? I'm like, paleo diet. Just do the paleo diet. I mean, I don't know if you agree with that. Like you kind of look at this a lot more than I do, but I'm just like meat and vegetables and you'll be fine. I mean, just guarantee it. And like, that's what I do. But I cheat a lot. I mean, I eat a lot of sugar. I eat a lot. I have a total sweet tooth. I drink Coke. I just do things in moderation and I exercise. Like you got to know your own body, but it's like you said, like when you start to look obese, that's your signal. That's your signal. Like that's cellular degeneration.
Can I push you on that? Can I push you on this? Can I throw out? I think the question of the personal responsibility thing is interesting. Can I throw out a couple ideas on that? Because this is a big one for me. 100%. We need a personal responsibility revolution. I think everyone in America, through public policy and so many cultural aspects you're talking about, are being treated like children, and we're robbing people of personal responsibility. Obviously, it has to start with the bottoms up, and many people are waking up. From Joe Rogan on down. Podcast, books, the leading ones in the country are talking about the need to not trust pharmaceutical products and all these hacks, but to look at the sunlight, to exercise, eat healthy. 100%. Yeah. But what you have right now is it's not just as simple as getting a little bit overweight and stopping to eat sugar. The USDA, which 95% of the panel that made the nutrition guidelines were paid directly by food or pharmaceutical companies, the USDA recommends to this day 10% added sugar for our entire diet for 2 years old and up. So what we're doing, and I think you just look at children, when you have close to 50% obesity or overweight rate and the prediabetes rate off the charts for children, this is a highly addictive drug. If you take a brain scan of a child on sugar, it's like giving them meth. And then so we actually recommend this addictive stuff, and we've weaponized it with our food. We're eating 100 times more sugar than we did 100 years ago. But the second big thing is that we actually pay for it. If you add up the ways we subsidize highly processed food, it's $100 billion plus. The food stamp issue, this is a program that 15% of the American people depend on. We can agree whether it's a good implemented program or not, but 15% of Americans, it's $115 billion. 10% of food stamp spending goes to sugary drinks. 75% of food stamp spending goes to ultra processed food. And that's just money. That's $10 billion a year transferring from the treasury coffers to Coke and Pepsi. I mean,
and you showed another stat, I think, in your writing.
Right.
When you look at the population that's on the SNAP program, the SNAP is food stamps, just for people who know.
Yeah.
Same thing. What is their obesity rate compared to the rest of the population? And diabetes rate.
It's double to triple. It's double to triple the rate of obesity and many other chronic conditions. A man at the lowest income level in the United States dies 12 years younger than a man at the highest income level. That's not because of a lot of these fake issues that we're talking about that's dominating, the news cycles. It is because chiefly of one thing. It is because of nutrition. And I think, to me, 100% we've got to have personal responsibility. But before we get into I don't want to ban sugar. I enjoy a glass of wine. I enjoy a dessert, right? But we don't recommend that children smoke or drink and get addicted. It is literally, I think, as unconscionable as saying that there's a recommended heroin level. If you actually analyze the devastation that sugar versus other drugs is causing, sugar causes multiples more deaths than any other drug. It's
help us out on this. I mean, this isn't exactly my my major, so to speak, on the legislative side. I don't do the ag stuff, which is the Committee on Agriculture is the Farm Bill, which is what deals with the food subsidies in particular. We do oversee NIH on my committee. So there's maybe some interesting things that we should be looking at there as far as what kind of studies are getting funded. And appreciate this kind of attention being brought to it. But how do we change? Because so one of the problems you're highlighting here is the kind of the instruction manual from the government, right? The source that people are supposed to be able to trust, and this food pyramid that anyone who knows just anything about modern science and nutrition knows is complete crap. Like it doesn't work, and it's not how you should be doing things. From the policy perspective, from my perspective, what could we look at? What could we do to at least change the instruction manual, the new nutritional instruction manual that the government stamp is on?
Yeah, I'll list a couple quick ones right now because a lot of people say, oh well, it's just eat better. Oh, or it's hard to societally change things, and get people eating better. What's hard right now is 93% of the country being metabolic dysfunctional. What's hard is that healthcare is the largest industry and the fastest growing industry, producing worse outcomes. We spend 2 times more on diabetes management as a government than the entire defense budget. So what's happening right now is hard. And here's a couple quick things. So the thing we need to understand is that, for better or worse, Americans listen to medical authorities. When that disastrous food pyramid came out, 20% of the American diet shifted to carbs and sugar. That's wrought trillions of dollars of budget issues for us and destroyed human capital. In the 1980s, when the Surgeon General, and I think as conservatives we can agree, it's like the Surgeon General, he's saying that smoking is bad. That's not a partisan thing. Like, smoking was bad. We were late on that. But when the Surgeon General said that, clearly smoking rates plummeted. Philip Morris was one of the 5 largest companies in the world back then. They actually diversified by buying out food companies, which we can get into later. But people listen to medical authorities, even with Dr. Fauci telling everyone to get the vaccine. Won't get into that. But most Americans, the vast majority of Americans, got at least one vaccine. So there's something that can happen tomorrow. And I think everyone should be asking why this isn't happening. The head of the NIH, the Surgeon General, the Dean of Harvard Med School could give a press conference at Congress tomorrow and say that we should move USDA sugar guidelines from 10% to 0%. We should not be recommending a substance that is not non-nutritious, that is wrecking metabolic havoc around the country and driving up trillions of dollars of healthcare costs. I don't know if I'm in a bizarre world, but when I look around a public space, everyone is overweight or obese. We are being crippled by prediabetes, diabetes. Life expectancy is going down well before COVID for the most sustained period since 1860. We are going bankrupt from healthcare costs, literally. We are becoming a fatter, more infertile, more depressed civilization. Male sperm count has plummeted 60% in a generation. This is because of food. And if you want to build it down, sugar. The USDA tomorrow, and this is what I would push, and what I would flag, it's like there should be hearings of Dr. Fatima Cody Stanford at Harvard, who's accepted tens of thousands of dollars from the obesity drug maker that's profiting off our obesity epidemic, and has said on 60 Minutes that obesity is not the result of what we eat, who is now on the Nutrition Guideline Committee for 2025. She is making the recommendations for our children, and she said
it's mostly genetic, right?
She said that obesity, which is only an issue in the past 40 years, is genetic, and quote, throw willpower out the window, quote, not because of exercise, not because of food, quote, it's a brain disease. And she is saying throughout, in every form that will have her, that if the government, does not pay for this obesity lifetime injection for kids starting at 12, that it's systemic racism. There's an all-out press.
Wow.
And Novo Nordisk, which is heavily lobbying, one of probably the largest funder right now of donations, and is lobbying Congress like crazy on this bill to approve obesity medications for Medicare and Medicaid. It will be the single most expensive drug in American history, right? And I just want to paint this picture. And if you're thinking just high-level investigations, kind of what to look at. Why wasn't the NIH? Why weren't all the mechanisms of health 10 years ago when I was helping Coke, saw them rigging the food stamp system, and we're paying $10 billion for kids to drink Coke. No, not a word from the American Academy of Pediatrics on that. The American Academy of Pediatrics is funded by Coke and majority funded by pharma companies. And now there is an all-out press. They're on Capitol Hill every day lobbying for government funding for a very dubious obesity medication. And what do we think is going to happen with this obesity medication? We spend $1 trillion worldwide on statins, heart disease is going up. 25% of women in the United States are on an SSRI antidepressant, and depression and suicide is going up. Yeah. Every drug we prescribe and are paying for and are bankrupting the country, the condition is going up. And this is exactly what's going to happen because when you have the head of the obesity clinic at Harvard saying, take this injection daily for the rest of your life, and she's literally saying, don't worry about what you eat. Even if you're eating 20% less poison, you're still as an American people, our children are eating ultra processed food, which is going to lead to depression and many other comorbidities.
Right. It's not
and
just
it's criminal.
The fat's a symptom, like you're saying, but there's other problems that are associated with obesity. I mean, you mentioned one I wanted to ask about. Like, is there a study that would show a direct correlation or even causality between obesity and mental health issues? Because obviously we've seen mental health issues skyrocket over the last couple decades. Like, is there anything relating that? What do we know about that?
There's if you are diabetic, you're 2 to 3 times more likely to commit suicide and have depression. We have to understand this. Our brain is part of our body. Our brain is nothing more than cells like the rest of our body. When we eat bad food, we experience metabolic, which is cellular dysfunction, right? Mm-hmm. Cells create organs function is disease. It's all the same thing. You look at the list of the top killers of Americans, suicide's number 10, right? You look at kidney disease, that's dysfunction of the kidney led by metabolic dysfunction, heart disease, right? But it's the same in the brain. It's the same in the brain. If you put let's just back up and use common sense. If you put any animal in a cage, and have limited sunlight, as we do with children with schools, and give them highly processed crap, frankenfood, right? And restrict their movement, they're going to go crazy. We are animals, like we are made, generate to eat and power ourselves. So to almost ask the question, and this is just my push on to even ask the question or be, I think we're systematically gaslighted from having common sense that the 1 ton of food, of the core fuel for our cells that we put in our body, doesn't have something to do with mental health, which there are astounding studies on. The book Brain Energy by a good doctor at Harvard, one of the few good ones, Chris Palmer, actually traces this just systematically, and actually explains how even something like schizophrenia, brain conditions like that, are metabolic conditions. But studies show that, for instance, 150 minutes, just 150 minutes of exercise for 3 months is significantly more effective than an SSRI at preventing depression. And we're writing about this with my sister, and I think a lot of studies. But if you cut ultra processed food for your diet and move 150 minutes a week for 3 months, your life will be transformed if you are depressed. And we should be saying that and encouraging that before prescribing SSRIs, which the FDA's own studies say are no better than a placebo.
Well, it's interesting when you got like real famous people like Jordan Peterson and his daughter, Michaela Peterson, and they have these crazy health issues. I can't even begin to describe what their health issues were. And they went on this like meat only diet. Is there a name for that diet? I don't know.
The lion's diet, they call it.
Just steak, like I've hung out with him a few times, and it's just orders giant steaks for lunch, just all the time. Yeah. But it like saved their lives, apparently. I mean, they can't deny, and it's not just them. Obviously, it's kind of started a whole movement. But I mean, and these supposed researchers just ignore this kind of stuff and say, "Oh, I mean, Lucky Charms is just as good." Like, are you kidding me?
Well, we've got to understand this. They're paid by the food companies want to make their food cheap and addictive. This is the core point I would make, and as a conservative, what I would push on. I think conservatives, kind of debating what page 300 of Medicare Part D could be reformed, we're missing the point. The problem with healthcare is that every single institution that impacts American health makes more money when people are sicker for longer periods of time, and they lose money when people are healthy. So the thing that is literally bankrupting our country, and I think destroying our competitiveness, is the fact that so many young people are sick. But a young person that's sick is an absolute gold mine. So imagine, a lower income, kid who's pre-diabetic, which is 25% of kids, as I mentioned, right? They're immediately put on the rolls. They're managing that diabetes for their entire lives, which costs over $1 trillion of taxpayer money. And then 80% of people with diabetes have at least 3 other comorbidities. So they're on this channel of treating just one thing after the next, which most of that's coming from the government. And that's a very profitable patient. If you take that child, all right, and even take the $1 million that Medicaid is going to spend on that, and think of any type of public policy solutions or ways to get that child to have more off with interconnectedness to their body, to understand about, to eat better, to exercise, that child is off the rolls. That's not a profitable patient, right? And that's the fundamental incentive problem. My sister, who's a top of her Stanford med school class, kind of the pride of the family, a doctor, she abruptly quit when she felt pressured to be systematically doing surgeries that were not necessary. And she was reprimanded by, the lead surgeons at Stanford Hospital for even thinking to recommend a dietary intervention. That is not considered serious medicine. And just think about how far we've kind of lost it, right? To think that it's pseudoscience to talk about movement or talk about the food we put in our body. So I hear you, and it's got to be a personal responsibility, but like, I guess just getting to the brass tacks and where we incentivize this, and just one more idea on that is we're funding our destruction. And I think a huge issue for everyone, it's a bipartisan issue, but particularly conservatives, I think, because there's lack of leadership on the other side of this, is the SNAP, what we used to call food stamps. We're the only country in the world where our nutrition program for lower income folks goes 75% to ultra processed food. And I used to be gaslighted in this when I was lobbying, and helping Coke early in my career. I used to say, well, we don't want to be a nanny state. We don't want to tell lower income folks. No, it's the reverse. It's actually complete corporate cronyism, corruption that we are steering. If we're going to have SNAP, it should not be going to inject poison. That's addictive. That's costing us trillions of dollars of healthcare costs. So I think it's a big initial, and Coke, if we just highest level, like why is Coke paying the NAACP to say that not supporting Coke on food stamps is racist? Why are they paying hundreds of millions of dollars, Coke alone, to create nutrition studies for the express purpose of confusing Congress, as the cigarette companies did? Why are they able to donate to the American Academy of Pediatrics and the American Diabetes Association? Why is the American Diabetes Association, which has actually statutory power from Congress, and the American Medical Association to set the standard of care in this country, Why are they a wholly owned subsidiary of pharma and food companies? Why did they get paid so much money from Coke? The American Diabetes Association advertised Coke on its website when and this isn't even a debate, there's nothing that has led to diabetes more single item than sugary drinks, which is a wholly new invention and is basically a nuclear weapon to our blood sugar. I don't think Coke should be banned. But
not banned, but we shouldn't subsidize it, right? Like
we shouldn't subsidize it.
I want to give my perspective on it. It is all interesting, and I don't know the ins and outs and who's paid for what and why they did it. I do think sometimes we attribute this sort of collective conscious planning that is more incompetence than it is conspiracy. With hospital systems keeping patients sick. I think that's more incompetence than it is conspiracy. That's my just dealing with the healthcare system. I'm on the healthcare system, or I'm on the healthcare subcommittee. I see these things, but and I should tell the audience too, just from the congressional perspective, I think our problem in Congress is we just don't even talk about the issue. We're actually not swayed one way or the other. I don't see these lobbyists you're talking about, and I'm on the committee. Okay. I'm on the subcommittee that deals with this. I'm on the healthcare subcommittee under Energy and Commerce that oversees, NIH and all these kind of things. So FDA, all of it. We don't hear from them. Maybe not yet. Maybe they're coming, maybe they're on their way. Maybe they know that I'll call them out. Maybe they know that I'm against obesity. I don't know. But I think the problem is we just ignore it. I love your idea of just doing a hearing on it. I'm definitely going to talk to our chairman about that. I think he'd love it too. I think there'd be bipartisan support for some truth telling. Because the thing about people need to understand about politicians is, because this is a common, and this, but I'm telling the audience.
Yeah.
We can't really be bought off by a corporation. We can't, because the most a corporation can give me is $5,000. It's nothing. That's meaningless to me. So you can't buy us up. To the extent that PACs, corporate PACs, give politicians money, it's because the politician they already agree with them. That's, in my experience, that's almost always what I see. I haven't seen it any other way. The sugar industry is very big in Congress. Now, would they go against this? Yes, but would it matter to politicians? Not all. I don't know. I'm not seeing it. Maybe to the politicians that literally represent those industries, literally in their district, because there's actual sugarcane farm. But I think honestly, I just think people are just not that informed on this. I really think that's the problem. And I think we can fix that. That's why I wanted to do this podcast. I think we can fix that and do the kind of hearing that you're talking about and ask these tough questions. And I think it would actually be bipartisan. So I'm maybe a little bit more optimistic on how we can solve this. I do think the hindrance would be it's more the fat shaming. I think that's where the politicians get cold feet. It has nothing to do with the industries or all of that pressure. I think they're way more scared of the political correctness aspect of it. Because our society right now has gone beyond just being afraid of fat shaming. It's fat promoting. Remember Jordan Peterson?
Yeah.
Bring up Jordan Peterson.
No,
he got in because he's because they had this really big model it wasn't even big bone. There is thicker people. That's truly genetic, obviously, but that wasn't that. It was it was obesity. And he's no, that's not beautiful. And he just got torn apart for it. And you're but you can't tell people they're fine the way they are when they're actually harming themselves. That's not what you do when you care about someone. That's not what I'm going to do to my kids. I'm going to tell them the truth because I love them.
Right. 100%. And I think just what I've seen is kind of the playbook working for Coke 10 years ago. It just came out that Nestle and other processed food companies are paying body inclusive TikTok influencers millions of dollars. So there's a huge coordinated campaign.
Interesting.
I really do think this kind of fat shaming and stress around that it's systematically being driven. The LA Unified School District, the largest district in the country, posted an Instagram post from a influencer that was funded by processed food companies saying it's racist to question anything anyone's eating, and that the only reason a donut is bad is because if it has mold on it. And you can almost have this corporate, I hear you. That's so interesting to hear that on the ground. I would say, I do think there are many people, unimpressive people around DC thinking about who to fund to kind of obfuscate the debate. I think it's been wildly successful, that the fact that, hundreds of billions of dollars go to subsidizing these ingredients, these indicative ingredients, and it's still just totally blamed on Americans when 80% of Americans are suffering.
Let's clarify those subsidies, because what you're talking about is your typical kind of farm subsidies, right? And you're talking about those subsidies going to like sugar and corn. So
Food stamps. I would say food stamps and federal funding, and federal funding for one of the largest sources of meals for children is federally funding. There's school meals, which is somewhat federally subsidized, where there's zero sugar limit.
Because like on the other hand, I do think we have to keep our farmers competitive and to maintain this our basic food production in America, which I think is a national security issue. Just 100%. Just so people understand, that's why we do a farm bill. Does it maybe go to exactly the right people? That's a debate we have every single time we pass the farm bill. And but what you're saying about SNAP, so that's interesting. Let's talk kind of philosophically about that. Like, what can we restrict on SNAP? Because your conservative mind is like a personal responsibility. You got to let people just choose. But on the other hand, you're giving them the money. So we always attach strings to money that we're giving someone, right? Conservatives are also for work incentives, right? We say, because our platform is, if we're giving you a welfare check, you have to be looking for a job, or whatever. There's work incentives. Like, Democrats disagree with that. So it's actually not. I don't think it's completely against conservative philosophy.
There's nothing conservative. Yeah. There's nothing conservative
to say that you should have a list of things you can buy with SNAP program, especially if the problem is this obvious and severe. And that statistic is correct, where SNAP recipients are 2 to 3 times more likely to have diabetes and live 10 to 15 years less time. It's like it's not because they're starving. It's because they're getting the wrong food. That's a problem. That's a problem. How would we micromanage that? Like, how would we go about that? Would like soda drinks be the first thing off the list? Like, how, because it gets difficult, doesn't it?
So you're being, and maybe lobbies might not be in your office, but you're certainly being, there's a systematic effort to make you think that it's complicated. I would posit that it's actually not. If you try to minimize 3 ingredients from the American diet, which is sugar, highly processed grains, which is a new invention in the past 110 years, the shelf-stable grains, which turn into glucose in our blood, take the fiber off, which is the processing, and I think are highly destructive. And then seed oils, which are an industrial product created by John Rockefeller in the early 1900s as a byproduct of oil, and are now the top source of American fats and highly subsidized. If you can limit those 3 ingredients, which are foreign substances that are the foundation, those are the foundation of ultra processed food, which is 75% of our diet. So, but I actually just if I kind of pitch you, I think, getting into the weeds on nutrition policy, I'm sure does kind of lose a lot of people. If I think there is a very clear actually platform to get sugar off of food stamps, to just take sugary drinks, which there's reams of scientific evidence that specifically sugary drinks are absolutely devastating. There'll be a lot of hand wringing. There'll be a lot of, but like, I think it's a point that parents are strongly supportive of from both sides of the aisle. I think that people are waking up to this issue, not just on obesity, but just looking at what's happening to kids. And I don't think a single mom, wants Coke available and these highly addictive things available. Like, the government needs to show some leadership. So even taking the one,
I guess what I mean by complicated is I'm thinking from the consumer perspective. Okay, so because I'm not. This is just coming from my ignorance in exactly how the food stamp process works. Okay, so you apply for food stamps, you get food stamps. You have what, like a card? I mean, again, I'm kind of
you have a card that's
so you go into
certain foods.
You can go to any grocery store, or just some grocery stores.
Or gas stations that just sell processed food right now. Yeah.
Okay. And you can't buy alcohol, right? You can't buy that with it. But other than that, you can buy kind of whatever you want. Like, how does the consumer even know what they're allowed to buy? And this is why I say it could get complicated. So I mean, banning like sodas, that's not that complicated. That's pretty straightforward. But when you're talking about like other sugary foods, like how do you do that?
I mean, my just for simplicity, I would just say start with soda, just to make it dead simple and simple. But if you actually want to create a good program, you would be able to buy food that wasn't ultra processed on food stamps. And the second that law is passed, everyone will hand wring. The second that law is passed, Amazon and other companies will have stores in food deserts, which we call them now, tomorrow. Like the second, this is $115 billion of government money, right? This is a huge pot of money.
Yeah, the market will respond. Yeah.
this second, and what we're being told, Dan, is like, oh, we need to be incremental here. We need to like this is how I'd say it high level from like just communicating how to communicate it. It's like 93% of the country's metabolic dysfunctional. Healthcare costs are going to bankrupt the country because of metabolic dysfunction. Like this actually isn't like an incremental issue. Like we need to not use government money to fund ultra processed food. In Sweden, the lower income folks have a card and they're able to go buy fresh groceries, and there's actually more packaged fresh things. And like Amazon and all these companies, tomorrow, if you set actual rational guidelines to encourage natural foods, you'd have the market fill that immediately. We do have a market disassociation now. Right now, it is cheaper to buy Coke than water because there's so much subsidies in Cokes. The one thing I just say on the agriculture subsidies, I totally hear you. Farmers are going to save this country. Farmers will save this country. They're a huge part of the solution. But I will say 90% of the agriculture subsidies are for these monocrop things like wheat, soy, corn. Only 0.4% of the agriculture subsidies go to fruits and vegetables. So again, there's a lot of complicated things here.
Why is that? Why do you think? Because I'm not on the committee that does that farm bill, so I'm really curious about that stat. Do you know why?
Well, farmers aren't happy. Farmers aren't happy with it. It actually started with good intentions from the Nixon administration when hunger was an issue and food price fluctuation was a big political problem for Nixon. So we're gonna solve hunger, and there was a huge emphasis on more shelf stable goods. So there was a huge funneling of subsidies to the type of crops that could be processed into grains that create shelf stable goods, potentially with good intentions also for the political vulnerabilities around food prices. That then was completely taken over, by lobbyists, and good intentions turned into what we have today, which is where we have a monocrop system, which farmers don't like, but have to get into because of the subsidies and because of the rigged market, not the free market. A lot of farmers I'm talking to would like to shift to a more regenerative situation, would like to be raising, more pasture raised meat and more, diverse crops, but they're funneled into this because, again, 75% of our diet has shifted since the 70s, has gone up dramatically to ultra processed food because of those incentives. So there's a huge unwinding we have to do here. But I think we're in a phase right now where people really are. I mean, Tucker Carlson, I don't know if you're, I disagree with him and agree with him, but he's been
not friends.
I know you guys are not. There's a lot of, I know, but it is interesting. It's notable that he is talking about this issue every night in a totally non-partisan, non-political way, and saying that his audience, it's one of the most resonant things for his audience throughout Fox News, conservative media.
Well, I'm glad to see he's doing something productive.
But there's something that's resonating, and I think, again, if I just were to high level calling this out, the USDA recommendations, food stamps, even talking to Coke and other processed food companies about how they're rigging things. Academic studies, NIH researchers can take payments from food companies and pharma companies. Between 2012 and 2019, over 8,000 researchers had significant conflicts of interest who did pharma or nutrition research, according to ProPublica. But it's like starting to expose this and unwind it a little bit. Why are you, and I'm sure you'll have more people telling you how confusing nutrition is. Why do we have?
Nobody told me that. I mean, you made the insinuation that there's a lobbyist here. I'm in Houston. There's no lobbyist here.
No. So, okay. Well, I guess I should. I'm
telling you, we just don't hear about this. I'm just telling you, that's the truth about Congress. Everybody always thinks I don't know. People's minds go to, I think, people make a lot of assumptions.
Kind of just incompetent sometimes. Or just
it's just been ignored. There's a million other things to deal with on any given day, and so it's gotten ignored. If I think it's perfectly plausible that there'd be bipartisan effort to have a hearing on the obesity epidemic. I mean, I don't see any pushback at that. People really overestimate how much power lobbyists have on Capitol Hill. Vastly overestimate it.
Interesting.
It's just, they're just there. I mean, look, they give us honest assessments on how a particular bill affects their industry, and we either care or we don't, because in the end we represent our district. And so we only politicians' incentives are very clearly aligned with just getting reelected, and people are like, oh, you just want to get reelected. Yes, I want at least 50% of my constituents to think I'm worth reelecting. That's actually a pretty good incentive structure. It has nothing to do with money, nothing to do with anything else. We don't make money. That's so, yes, your campaign can make money, but that's not yours. In the end, it's just to tell people about yourself. And so, yeah, lobbyists are there. But I think the other things that you've tracked down and exposed are much more interesting. The studies, like the academic, that's more interesting to me. But I'll tell you, like, congressmen aren't reading those studies. Okay.
Right.
We're just not. Like, I've never seen those studies. I'm on the committee.
Yeah.
I also know what nutrition is. If I saw a study that said Lucky Charms was, and I did see the study, of course, and I tweeted about it.
Right.
I would just dismiss it. So, the problem is just its lack of attention. That's the problem on Capitol Hill, at least. That the problem elsewhere that you've noted is really interesting, like within like the institutions and the research and the authorities. Let's call them like the academic and the experts. Let's say that what you're talking about and kind of where the money's been going. That's problematic and interesting. I'm just telling you, we don't see it on Capitol Hill. You can believe me or not believe me, but
no. That's
but the fact that this is a public conversation that I'm having and saying all this, like, I think I'm pretty believable, because obviously Coke doesn't want me talking about banning Coke from SNAP program, and I'm doing it on my own podcast, which is an official government podcast. So,
can I ask?
We're obviously not. Yeah, go ahead.
Can I ask? So this is such okay. So Ozempic. So the way I'd frame the issue with Ozempic,
I wanted to ask you
why
about
it
that.
matters. Yeah, why I'd matter. So what's we've become, and this represents we the devil's bargain. We're getting sicker, obese, more depressed, more infertile because of food, and there's silence on that from every institution of health. And now there's, in addition to all the other chronic disease cures we have a miracle cure for obesity, which is being lobbied heavily to be recognized. Obesity is not something of choice, but as a condition that is just like getting a condition you can't control. So that the second that happens, Congress and nobody in government can regulate how many times it's prescribed from a doctor, and the target market here is 80% of the American adults, which is they're doing cartwheels at the JP Morgan healthcare conference, saying this is going to be the most successful drug in American history because government approvals coming. My point, and
I wonder if they're lobbying. They might not be lobbying Capitol Hill. They might be lobbying CMS directly.
There's a bill that has 250 or so, I think, co-sponsors in Congress, called the Obesity Treatment Act or something. That there's like a heavy, and then they're lobbying regulators too. But my fear on this is that we are, the budget line items, obviously, it's like more than anything, more than defense, which is a small line item compared to healthcare. And this will, by conservative estimates, double what Medicare spends on drugs, double, because it's $2,000 a month per person, as we know, when volume goes. So my
$2,000 a month, though, that's crazy.
Right now it's $2,000 a month. So
that would never pass.
Well, okay, what we're really pushing on, it sounds radical, but it doesn't make sense. Is that money would be better? You take that money and ask, how, from a public policy perspective, can we improve what these kids are eating? It's just so, you would never design a system where everyone's eating processed crap and then it's almost like a sci-fi novel, like a terrible sci-fi novel where they literally have like needles coming in.
It is kind of, yeah.
There's a way. So the one big trend, Dan, I think is the most important trend that in the next 10 years that's going to pick up is food as medicine. I mean, literally a food intervention it sounds kind of fluffy. I used to think it was fluffy. It is the best medicine. It is the top way, more than, it sounds so simple, but the way to reverse and prevent obesity is food. It's not an Ozempic deficiency. Yeah. And I just curious your thoughts here, because this Ozempic battle, if this passes, I'm scared for the budget of our country. And I'm scared more just spiritually, in a way, in our country, that we're telling everyone there's a hack for everything when there's really not. So I'm wondering what you're hearing on that, and whether there's
we haven't heard anything. Yeah. So I could text our kind of group text on the health subcommittee. I mean, we would be the ones who would be lobbied on this, and it's not happening. So I don't know, but again, in theory, the Secretary of HHS and CMS could just approve it, right? So because we're talking about a drug that's FDA approved, I'm assuming, but it's not on this. It's not necessarily coded in CMS. So
there's a battle to code it. There's a battle to code obesity as a disease that we don't have control over.
Right. And so that's not necessarily in congressional control. Now we could reverse it if the regulators decide to do it. And and now we know to keep an eye on it if it's going to double the budget. But for large decisions like that, it's pretty damn difficult to get through. I mean, there's a lot of things I want CMS to approve that they don't approve. That it's like a problem. They don't approve really good things that they should. And there's the cases like this that you're talking about, which I'm glad you're bringing to our attention. Something we should talk about. And look, maybe we do a hearing on it and we talk about it then in public. I think that's a great idea. Because I look, if you're asking my opinion on do I like the idea of this like fat drug or whatever you want to call it, or no fat drug or skinny drug. No, I don't like it because I 100% agree that, your obesity is not, it cannot be true that obesity, we're just finding out that obesity is purely genetic. And yet throughout human history, we've never had obesity problems. It just can't be true. We still have the same genetics.
It's absurd on its face. It's absurd on its face. So,
and you are creating this sort of like dystopian Brave New World society by, here's your pill. That's your nutrition for the day. Like, it's a little scary when you start to think about that.
Which I don't think parents are. Yeah, I just say, interestingly, the NAACP is registered for lobbying for Ozempic and is aggressively saying, again, that it's systemic racism not to have taxpayer money for Ozempic. And then, of course, the number one advertiser for mainstream media in this country is pharma, and there's a full court press now from that shameful 60 Minutes piece that did not question the genetic to pieces in the New York Times on down, breathlessly talking about how this is a cure and how it's a moral failing that we're not giving everyone Ozempic paid for by taxpayers. So to me, it is a cultural fight, and there's a lot to explore with the NAACP, with the racialization, with Harvard.
And it would literally be $2,000 a month is what this thing costs.
Right now it's $2,000 a month. And, and again, it's a weird, I'm just
Crazy.
saying what I'm hearing, but when the costs go up as outcomes go down, it's hard to, regulatorily change. So it's going to be, I mean, there's there's stocks being bought. There's cartwheels being done at JP Morgan. This is on track without question, according to all the experts, to be the most highest revenue generating drug in American history by far. Like those research reports are almost unanimous because of the expected taxpayer and I think thing that is a spiritual problem in the United States, making obesity not something we control. The fact that we
it's not your
control
fault.
it,
just take this drug. Yeah.
And that, a drug that government's going to pay for. And we're going to become like, what a wake up call that we're becoming more infertile and sperm counts plummeting and PCOS, leading cause of infertility, is skyrocketing. Like everything's happening at once. It's because of food. We're not going to solve it by spending hundreds of billions, if not trillions of dollars and more money on injections. It's a real, to me, Ozempic is a precipice moment because it impacts so much the country.
Yeah. Well, we need to look into it. It sounds like it's, again, this is when we talk about what drugs can be approved to be paid for by programs like Medicaid and Medicare. I'm not telling you, I'm telling the audience. Yeah. That is a regulator thing. It's not like Congress votes on every decision there. That's CMS decides that. Congress would have to reverse it. And that's something we need to look into, apparently. Cool. If
I think there's a full court press here. There's a full court press. Ozempic is unbelievably impressive, honestly, what they're doing to kind of jam this forward and impact public opinion. So, I'm scared for the budget of the United. This will be the most expensive drug in American history. And it's an opportunity to make a very simple point that we are being brought to our knees because of metabolic dysfunction tied to food and tied to the fact we are sleeping 3 hours less than we did 100 years ago. And kids are sedentary and Americans are these are basic things, and we can't have a full nanny state. But right now we have a reverse nanny state where almost every incentive of the healthcare system is propagating that stuff. And so food is medicine, thinking about treating that. As I said, our company is, if you have a doctor's note explaining a detailed food intervention, that can count for some healthcare spending, such as HSA, FSA, if it's a detailed food. So we're trying to enable that, which we think is a much better medicine. Yeah,
I agree. And my audience, if they listen to every podcast I do, they know my opinion on HSAs. Yeah. I want universal HSAs. I want to use them for primary care. I think I think it's plausible to use them for things like you're talking about for good activities such as clearly exercise and the right kind of nutritional diets. Well, so real quick, let's end with this. Let's tell people, okay, you guys have been complaining about the industry and all that, but tell me what I'm supposed to do. I want to get better. Okay, so What should people do? Should they, we talked about the paleo diet, again, meat and vegetables. Again, sometimes the stuff is really simple. Should they do like one of those food allergy tests? I mean, you can do these sort of personalized tests on what food kind of reacts best with your body. What do you think of those? And where you know, what's your website? Where should people go to find the right information?
Sure. So just really tactically, no doctor knows how to read even your free cholesterol panel, the triglycerides, HDL, things like that you get for free. Levelshealth.com, my sister's company, has a really good guide of actually understanding what high triglycerides mean. These are warning signs that you are going to get a disease, die earlier, and suffer along the way. They're actually very serious, and the guidelines on that are not clear. So that's a starting point. A company of our investor advisor, the hero of this movement, Mark Hyman, started, called Function Health, actually allows you to get 100 blood tests and really, in a very detailed way, understand. So I think the biowearable and understanding what's going on in our body is vital. It's still in over 20 U.S. states.
I have a lot of friends who are obsessed with those things. They're like, you got to get on it. I'm like, I don't want to wear it, but okay, maybe I will.
The levels, the CGM on glucose is very interesting. And in 20 U.S. states, the states don't actually legally allow patients to have ownership of their medical records. We have systematically prevented patients from understanding what's going on in their body. We know 100 times more what's going on in our car. So I do think this biowearable revolution, levels with glucose, is very important. I'd say on food, we are being gaslighted on the paleo, carnivore, vegan. We need to get to whole foods. Cut those 3 ingredients out. Seed oils, look at the label. Canola oil, soybean oil. We need good fats that we've eaten for hundreds of thousands of years. Olive oil, avocado oil, animal fats, high quality animal fats. So cut the seed oils, cut the highly processed grains, cut the sugar. That will inevitably lead you, whether you're a vegan or a carnivore, that will inevitably lead you to more curiosity about whole foods. And then step 2 is thinking about the micronutrients, macronutrients, fiber, things like that. But I'm telling you, if you cut those 3 ingredients, you're well on the way, whatever your dietary philosophy is. And then it's just quality foods. It's quality foods. The fact that we have such shitty it's okay. Cut that out. The fact that we have such terrible, hormone-ridden chemical. I used to think, let's not regulate, let's not have in any state. No, that's a result of the rig system. The fact that we have 2,000 chemicals that go into our food that Europe doesn't allow, I don't think that's a free market. That's a rig market. So it's just be curious about your food. And then I just got to say, and this is a journey we all should be on, and this is what medical leaders should be saying very clearly. Like, it is the basics. We are being lied to. We are the only animal that has systematic diabetes and obesity. It's the basics. It's sleep.
Are we the only country too? Like, what?
Oh yeah, it's crazy.
Which other countries have this? It seems to be a problem.
Well, we're exporting our diet. We're exporting our diet throughout the world. But no, it is an order of magnitude worse here than many other countries. Italy, which you'd think, they're eating a bunch of pasta, has 3 times lower, roughly. You check that exactly, but it's a substantially lower. Japan, a Japanese person in the United States. We say it's genetic. A Japanese person in the United States has a 4-time higher rate of obesity than a Japanese person. It's the pillars. It's food is number 1. We can't get away from that. Sleep, movement, and chronic stress management. I mean, it's basic, but we are just a chronic stress machines throughout every layer of society. And those are the things, both as a personal, but also a public policy standpoint. I mean, we should be, if there's $1 we're going to spend to reverse and make people healthier, that money, in my opinion, I think the science is clear on this, should go to food. It is absolutely shameful that Dr. Fauci spent the vast majority on down in the medical community of the airtime talking about the cure for COVID is a pharmaceutical drug. If you were metabolically functional and not obese, you had almost a 0% chance of dying of COVID, like every other condition. And the fact that we didn't rally the country around becoming more competitive, it was such an opportunity.
Well, it's not too late.
It's not too late. And people are waking up, and thank you for highlighting this. And this is pessimistic. I hope some of these messages lead to just more curiosity as the journey I've been on personal accountability. And just thank you for the opportunity. I do think there's some ways to investigate this and call out the corruption, which I do think, many Americans are waking up to, and it's animating people.
I think so. This has been really interesting. And
thank you, sir.
I appreciate your work on this, Calley. And
thank you, Dan.
We'll keep you updated on what we can do at our level.
I'll be in touch.
Appreciate you.
We got a lot of experts and warriors on this, whatever we can do. And thank you for highlighting this. And I think it's a first order issue for our kids, and so much appreciation for your leadership on this, and so many so many other issues.
No, 100%. Thanks for coming on.
Thank you. Thank you, Dan.
All right.